This conference will now be recorded.
Good morning, everyone. Today we'll discuss the formation of granulation tissue in the process of wound healing. Okay, what is granulation tissue and what are the steps in wound healing? We'll discuss in detail. Healing is the body response to injury in an attempt to restore normal structure and function. This healing involves two distinct processes. Either it can be regeneration or it can be repair. What is regeneration? Healing by regeneration. It is when healing takes place by proliferation of parenchymal cells and usually results in complete restoration of the original tissues. When there is proliferation of parenchymal cells and when there is complete restoration of the original tissues, it is called regeneration. Or the replacement of the destroyed tissue by parenchymal cells of the same type is called regeneration, or the replacement of destroyed cells by proliferation of surrounding undamaged cells of the same type is called regeneration. Okay, regenerative capacity of different cells. The cells of the body are divided into three groups on the basis of their regenerative capacity as labile cells, stable cells, or permanent cells. These labile cells are continuously dividing cells. Example, epidermal cells of skin or lining epithelia of the various tracts, urogenital, gastrointestinal. Okay, these are the labile cells which are continuously dividing cells. Stable cells or quiescent cells. These stable cells or quiescent cells are the cells which regenerate only when necessary. That is, when the parenchymal cells of that tissue are destroyed, like liver. Okay, liver cells are stable cells. Permanent cells are non-dividing cells. Okay, these never regenerate, like neurons, cardiac muscular cells. These are permanent cells. Okay, all these cells will be cell growth will be controlled by the growth factors. Okay, next, coming to repair. Repair is when healing takes place by proliferation of connective tissue elements resulting in fibrosis and scarring. Okay, when there is proliferation of connective tissue elements, it is repair, and this results in fibrosis and scarring. Repair is the replacement of injured tissue by fibrous tissue. Okay, repair is the process by which lost or destroyed cells are replaced by viable cells. At times, both the processes, that is regeneration and repair, takes place simultaneously. Okay, in the repair, two processes are involved: granulation tissue formation and contraction of wounds. Repair response takes place by participation of mesenchymal cells consisting of connective tissue, stem cells, fibrocytes, and histiocytes, and endothelial cells, macrophages, platelets, and parenchymal cells of the injured organ. All these cells take part in the process of repair. Okay, and repair consists of two processes: granulation tissue formation, which we will discuss in detail, and contraction of wounds. Okay, that condition in which repair is achieved is when resolution fails to occur in acute inflammation. When resolution fails to occur in an acute inflammation, and when parenchymal cell necrosis cannot be repaired by regeneration because necrotic cells are permanent cells, stable cells are destroyed here, and necrosis is so extensive that no cells are available for regeneration. These are the conditions in which tissue is repaired. Okay, by scar formation. What is granulation tissue? It is a young scar. It is highly vascularized connective tissue composed of newly formed capillaries, proliferating fibroblasts, and residual inflammatory cells. This connective tissue consists of newly formed capillaries, proliferating fibroblasts, and inflammatory cells. The term granulation tissue derives its name from slightly granular and pink appearance of the tissue. Each granule corresponds histologically to proliferation of new small blood vessels, which are slightly lifted on the surface by thin covering of fibroblasts and young collagen. And there will be new blood vessels formation and fibroblast proliferation and collagen deposition. Okay. Granulation tissue is new connective tissue and tiny blood vessels that form on the surfaces of a wound during the healing processes. Granulation tissue typically grows from the base of the wound and is able to fill wounds of almost any size. Granulation tissue forms and fills the injured area while the necrotic debris is being removed. What is granuloma? Granuloma is defined as a circumscribed tiny lesion about 1 mm in diameter composed predominantly of collection of modified macrophages called epithelioid cells and rimmed at the periphery by lymphoid cells. The word granuloma is derived from granule, meaning circumscribed granule-like lesion, and oma, which is a suffix commonly used for true tumors, but here it indicates a localized inflammatory mass or collection of macrophages. This granuloma mostly consists of modified macrophages called epithelioid cells, which are rimmed by lymphoid cells, fibroblasts, and connective tissue. Granuloma is collection of epithelioid cells rimmed by lymphocytes. So this is a granulation tissue which is pink and glistening. Okay, this is also an example of granulation tissue. Okay, after development of a wound, after these are the days after wound, first inflammation occurs first, that is clot formation and chemotaxis, then reepithelization, angiogenesis and granulation tissue after 1 week, and there will be provisional matrix formation. Next after 2 weeks, collagen matrix formation and wound contracture, and finally collagen deposition. Okay, stages of inflammation, proliferation and maturation. So first inflammation, next 3 to 10 days granulation, next in the second week wound contracture. Collagen accumulation and remodeling starts after 3 days. See, this is healing by primary intention, when there is a small wound and when the cut ends are clean and sharp, there will be scab formation, neutrophils and clot formation, platelet clot and neutrophils accumulate within 24 hours. Whereas in wound healing by secondary intention, there will be, when this secondary intention, wound heals by secondary intention, when the cut ends are very large, very big cut ends. Okay, and by the end of 3 to 7 days, there will be granulation tissue formation in healing by primary intention. Macrophages, fibroblasts and new capillaries are formed, and here it is more prominent in healing by secondary intention. By the end of 2 weeks, there will be fibrous union. Okay, wound contracture occurs when healing by secondary intention. Okay, wound healing by primary intention, it just lined up. In secondary intention, it just not lined up. More granulation, more epithelialization and more fibrosis in healing by secondary intention. The following 3 phases are observed in formation of granulation tissue. Phase of inflammation. Following trauma, blood clots at the site of injury, there is acute inflammatory response with exudation of plasma, neutrophils and some monocytes within 24 hours. There will be acute inflammatory response and the blood clot at the site of injury, and there will be acute inflammatory response with exudation of plasma, neutrophils and monocytes within 24 hours. This is phase of inflammation. Next, coming to phase of clearance. This is combination of proteolytic enzymes liberated from neutrophils, autolytic enzymes from dead tissue cells and phagocytic activity of macrophages clear off the necrotic tissue, debris and red blood cells. This is phase of clearance. Next, coming to phase of ingrowth of granulation tissue. This phase consists of 2 main processes: angiogenesis or neovascularization and fibrogenesis. What is angiogenesis? It is formation of new blood vessels at the site of injury, which takes place by proliferation of endothelial cells from the margins of severed blood vessels. Okay, formation of new blood vessels at the site of injury is angiogenesis or neovascularization. Initially, the proliferated endothelial cells are solid buds, but within a few hours develop a lumen and start carrying blood. The newly formed blood vessels are more leaky, accounting for the edematous appearance of new granulation tissue. This edematous appearance of new granulation tissue is due to leaky newly formed blood vessels. Soon these blood vessels differentiate into muscular arterioles, thin-walled venules, and true capillaries. The process of angiogenesis is stimulated with proteolytic destruction of basement membrane. The process of angiogenesis is stimulated with proteolytic destruction of basement membrane. Angiogenesis takes place under the influence of following factors: vascular endothelial growth factor, platelet-derived growth factor, transforming growth factor beta, basic fibroblast growth factor, and surface integrins are also associated with cellular proliferation. These all factors are important in the process of angiogenesis. Vascular endothelial growth factor is released by mesenchymal cells, while its receptors are present in endothelial cells. Okay. Next, coming to fibrogenesis. The newly formed blood vessels are present in an amorphous ground substance or matrix. The new fibroblasts originate from fibrocytes as well as by mitotic division of the fibroblasts. Collagen fibrils begin to appear by about 6th day. Okay. As maturation proceeds, more and more of collagen is formed while the number of active fibroblasts and new blood vessels decreases. This results in formation of inactive looping scar known as cicatrization. Okay, more and more collagen is formed. This is cicatrization. A fibroblast is a type of cell that synthesizes the extracellular matrix and collagen and the structural framework stroma for animal tissues and plays a critical role in wound healing. Fibroblasts are the most common cells of connective tissue in animals. These fibroblasts and fibrocytes are two states of the same cells. The former, that is fibroblast, being the activator state, and the latter, the fibrocytes, are the less active state concerned with maintenance and tissue metabolism. Currently, there is a tendency to sell both forms fibroblasts. The suffix blast is used in cellular biology to denote a stem cell or a cell in an inactive state of metabolism. Okay. Coming to the gross morphology of granulation tissue, during the migratory phase of wound healing, granulation tissue is light red or dark pink in color, being perfused with new capillary loops or buds, soft to touch, moist, and bumpy, that is granular or pebbly in appearance due to punctate hemorrhages, pulseful on palpation, and painless when healthy. Okay. Microscopic features are: microscopic examination shows thin-walled capillaries lined by endothelium and surrounded by fibroblasts. Okay. These are shows thin-walled capillaries lined by endothelium and surrounded by fibroblasts, and there will be plenty of residual inflammatory cells like neutrophils, lymphocytes, plasma cells, and macrophages. See, this is the active granulation tissue showing neovascularization. These are the blood vessels, newly formed capillaries, plasma cells, the thick acute inflammatory infiltrate like plasma cells, neutrophils, lymphocytes, fibroblasts also can be seen. Fibroblasts, these are spindle-shaped fibroblasts. Okay, neovascularization and residual inflammatory cells. Granulation tissue in the ulcer base. See, this we can see newly formed blood vessels lined by plump endothelial cells, and edema and inflammatory infiltrate are also can be seen. This is a fibrotic tissue beneath the ulcer base. Okay. What are factors affecting this repair? Fibronectin. This is an adhesion protein. It is the glycoprotein that plays a key role in the formation of granulation tissue and is present in large amount during wound healing. In early phases, it is derived from plasma, but later it is synthesized by fibroblasts, macrophages, and endothelial cells in granulation tissue. Fibrillar structural proteins are collagen and elastin. Adhesion proteins are fibronectin, laminin, fibrillin, osteonectin, and tenacin. Coming to fibrosis, collagenation. Collagen is the major fibrillary protein of connective tissue. It is synthesized by fibroblasts and is responsible for much of the tensile strength of the scar tissue. The term fibrous tissue and scar tissues are synonymous with collagen. Okay. Methionine, Proteins are needed for the process of healing. Methionine, an amino acid, is essential for building up of granulation tissue. In protein deficiency, granulation tissue and collagen production is delayed, resulting in weak scar. Vitamin C. Vitamin C is essential for the synthesis of collagen fibers. In vitamin C deficiency, fibroblasts produce little collagen, therefore healing is poor and delayed. Coming to the maturation of the scar, as the scar matures, the amount of collagen increases and the scar becomes less cellular and less vascular. The matured scar is composed of avascular, fully cellular mass of collagen and is white on gross examination. Formation of excessive amount of granulation tissue which protrudes above the level of surrounding skin is called proud fresh. This is the example of proud fresh. And contraction, finally contraction of the wound. Contraction decreases the size of scar and enables the surviving cells of the organs to function with maximum effectiveness. Okay, this is about scar formation, wound healing, and especially granulation tissue formation. It is a process in the repair and it contains angiogenesis and fibrogenesis. For what is granulation tissue? It is accumulation of newly formed blood vessels, that is neovascularization with many acute inflammatory cells. Okay, neutrophils, lymphocytes, plasma cells, and macrophages. Okay, this is about granulation tissue. And on gross morphology, it is light red or dark pink, soft to touch, moist, bumpy, pulseful, and painless. And it consists of thin-walled capillaries lined by endothelium and surrounded by fibroblasts. And there will be plenty of residual inflammatory cells like neutrophils, lymphocytes, plasma cells, and macrophages. This is a granulation tissue. Newly formed blood vessels, neovascularization, plasma cells, macrophages, lymphocytes, neutrophils, and there will be plenty of fibroblasts, neovascularization, fibroblasts, and inflammatory infiltrate. This is an active granulation tissue.